Side effects from the COVID-19 booster are to be expected, but some are more serious than others. Based on recent health data, this is everything you need to know about getting your booster. Wherever you're planning on receiving your booster shot, the vaccine center will most likely provide simple instructions in advance of your appointment. One of those instructions will be to bring your existing COVID-19 vaccination record card with you to your appointment. That means the actual card unlaminated, not just a photo of it. Although a digital photo of your card is perfectly fine for sharing your vaccination info, you'll still need the actual card with you so that you can update your vaccine record with your booster information, including the manufacturer, lot number, and date of your appointment. If you can't locate your card or if you never received a card when you were vaccinated initially, don't worry. A representative from CVS told Health Digest to do the following. At the time of your booster shot, ask the healthcare worker who is administering your shot to confirm for you the manufacturer and lot number for your booster shot. Write it down and keep it in a safe place, and when you have your vaccine card in hand once again, make sure to add this information and then take another photo of your card. The mRNA technology behind the Pfizer and Moderna COVID-19 vaccines and boosters isn't new. It's actually been in development for more than 15 years. And all the COVID-19 vaccines and boosters that are subject to emergency use authorization in the United States have been clinically proven effective at mitigating the spread of COVID-19 and reducing the risk of contracting a severe form of the illness. At the same time, they have also been found to be safe. The CDC states that all of the COVID-19 vaccines subject to emergency use authorization were evaluated in clinical trials by tens of thousands of participants and met the Food and Drug Administration's rigorous scientific standards for safety, effectiveness, and manufacturing quality.
We had 5 phase 1 clinical trials of different mRNA vaccines that we were working on before COVID-19 ever hit.
Further, the CDC states millions of people in the United States have received COVID-19 vaccines under the most intense safety monitoring in U.S. history. Part of that safety monitoring process has involved asking that vaccine and booster shot recipients remain at the vaccine center for a short observation period, lasting between 15 and 30 minutes after the injection. The observation period was primarily put in place to record and address any immediate acute reactions people may have to the vaccines, but those reactions have been observed only in rare cases. Despite that rarity, you should still stick around for the full observation period. If something does go wrong, you're going to want to be surrounded by medical professionals, not stuck in your car on the way home. If you have any doubts or questions during the observation period or you think you're having an allergic reaction, let medical personnel at your vaccine site know immediately so that your issues can be promptly addressed. According to the CDC, what clinicians are most concerned about during the observation period is anaphylaxis. Anaphylaxis, which is rare to begin with, is described by the Mayo Clinic as an acute and potentially life-threatening allergic reaction. The Mayo Clinic notes the most common triggers for anaphylaxis are certain foods, although it also may occur in connection with some medications. It could also occur as a reaction to some insect stings or an exposure to latex. Anaphylaxis has been observed in only rare cases following a COVID vaccine or booster shot. The CDC says that safety monitoring of the Pfizer vaccine against COVID-19 in the United States during a 1-week period in December 2020 detected just 21 cases of anaphylaxis out of 1,893,360 doses, or about 11 cases per million doses of the vaccine. The CDC noted that 71% of these occurred within 15 minutes of vaccination.
I had my mask on, and I told my husband, "Can you roll down the window? I have a little bit of problem breathing."
If you have no allergies to medications, have never experienced anaphylaxis, and especially if you didn't experience a severe immediate reaction in connection with your initial COVID-19 vaccine or vaccine series, then the risk that you will experience anaphylaxis from your COVID-19 booster shot becomes even smaller. Either way, all vaccine sites are required by the FDA to be ready to deploy immediate emergency care in the event a vaccine recipient experiences signs of anaphylaxis. All medications have the potential to cause side effects, and the COVID-19 vaccines and boosters are no different. Whether it's your first, second, or third shot, some side effects are to be expected and tend to present within 24 hours after the injection. Don't worry when they do. In fact, you might even consider looking at them in a friendly kind of way, because experts say that the side effects may be signs of your body mobilizing its plan of attack against future exposure to the coronavirus. Specifically, with regard to boosters, the CDC has stated that reactions reported after getting a booster shot were similar to those observed after getting the primary vaccine or vaccine series. The most common side effects include redness, swelling, and pain at the injection site, fever, headache, tiredness, muscle pain, chills, and nausea, according to the CDC. Overall side effects have been mild to moderate. More serious side effects are possible, but rare. According to the CDC, the systems that have been put in place to monitor the safety of COVID-19 vaccines have found 4 types of serious side effects, which they refer to as adverse events. The first is anaphylaxis, which is rare and tends to present immediately after exposure. The next side effect is inflammation of the heart, which is also rare and can present as either myocarditis, inflammation of the heart muscle, or pericarditis, inflammation of the heart's lining. The third is Guillain-Barré syndrome, another rarity and which causes neurological symptoms and muscle weakness. Thrombosis with thrombocytopenia syndrome, or TTS, is the fourth potential serious side effect, which is not only rare but also seen primarily in those who received the vaccine manufactured by Johnson & Johnson. Because of this, and because of concerns that the Johnson & Johnson COVID-19 vaccine may not be as effective as the Pfizer or Moderna vaccines against COVID-19, the CDC has taken steps to narrow use of the Johnson & Johnson vaccine, according to NPR.
An advisory panel to the CDC saying people should not get the Johnson & Johnson vaccine if the Pfizer or Moderna shots are available.
Any side effects that you may experience after getting a COVID-19 booster shot may have the potential to interfere with your ability to engage in your everyday activities. However, this does not mean your side effects are necessarily serious or life-threatening. That being said, if you find that your side effects are not getting better after a few days, the CDC advises calling your healthcare provider. In addition, you'll want to check in with a healthcare provider if your side effects seem to be getting worse after the first 24 hours after your COVID-19 booster shot. Of course, anytime you are in doubt about a side effect or other symptom, it's reasonable to check in with your healthcare provider. Further, if you feel that your side effects are rising to the level of an emergency situation, you should call 911 or go to the emergency room. But again, the odds of this happening after your booster shot are small. In the unlikely scenario that you experience serious side effects from your COVID-19 booster shot and you seek medical assistance, your healthcare provider is expected to make a record of the occurrence of an adverse reaction and notify the CDC. If your side effects are minor enough that they don't require you to see a medical professional, you could report your side effects to the CDC yourself. Doing so is as easy as logging into the vSafe app provided by the CDC. According to the CDC, vSafe is a smartphone-based tool that uses text messaging and web surveys to give personalized health check-ins after you receive a COVID-19 vaccine. This app was designed to make it easy and fast to notify public health authorities that you have experienced side effects after receiving a COVID-19 vaccine. The information is kept private by law, and it's important to share in the name of public health. The information you provide will help the CDC and other public health authorities monitor the safety of vaccines in close to real time. Once you get your booster, you should be prepared to keep track of your up-to-date vaccination record, as many cities still require proof of vaccination to attend events, enter buildings, and more. Since November 8, 2021, anyone flying into the United States has had to present proof of vaccination against COVID-19, with only limited exceptions, and that includes U.S. citizens, according to federal regulation. Some vaccine requirements have also been imposed on both public and private sector workers, meaning an up-to-date vaccine record may be necessary to work in some places. State governments and many businesses are divided on the topic, so check your local regulations to know what you need to do. For now, the easiest way to move and work freely is to keep your vaccines current and your vaccine records close. As with vaccine mandates, the United States as a whole is not in agreement as to whether masking should be required and under what circumstances. As of January 3, 2022, 8 states require masks in indoor public places, regardless of vaccination status. These are California, Hawaii, Illinois, Nevada, New Mexico, New York, Oregon, and Washington, with Washington requiring masking even at outdoor events that are attended by 500 or more people.
While outdoor gatherings are generally lower risk, the health department says there have been 5 outdoor superspreader events in the state.
In addition, Washington, D.C., along with the territory of Puerto Rico, have imposed similar orders. Connecticut, by contrast, which dropped its state-mandated mask requirement early on in the pandemic and then reimposed it only to drop it again, has now reimposed a masking mandate that applies only to the unvaccinated. Other states, such as Rhode Island, require masking at large venues but allow smaller businesses to decide for themselves based on the vaccination status of those seeking to enter those businesses. And within states that do not impose masking mandates, there can be great variation among the various municipalities as well as private businesses. In general, the CDC recommends masking regardless of vaccine status in healthcare and long-term care facilities, prisons, homeless shelters, on public transit, and in transportation hubs like airports and bus and train stations, with most states making efforts to follow along with those guidelines. Check your local guidelines for specific advice on what you need to do. In the CDC's eyes, a person is considered fully vaccinated against COVID-19 within 2 weeks after the receipt of their full primary vaccine series, whether that is 2 doses of an mRNA vaccine or 1 dose of Johnson & Johnson. According to the CDC, as of January 6, 2022, administration of an additional primary dose or a booster dose is not required to be considered fully vaccinated for public health purposes at this time. The CDC is also currently making no distinction between the various vaccines or vaccine booster combinations. The COVID-19 pandemic has been a constantly evolving situation, and guidelines about vaccines, boosters, and mask policies may change in the future. For now, most importantly, you should know that the booster shot can increase your body's resistance to the coronavirus and keep you and your loved ones from getting severely ill. Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest COVID-19 developments are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.